Evening, everyone, and welcome to the Results Grassroots conference call for December. I really cannot believe that we're almost through the year already. It's absolutely flown past. I don't know about you, but I am really ready for my Christmas break. For those of you that are joining us for the first time, my name's Aaron Oxley. I'm the Executive Director at Results UK, and I'd like to welcome all of you to the meeting this evening. Now, we'll start off with the usual housekeeping messages. We're recording the call and we're going to post the recording to our website for anyone who's missed this to watch later. So please feel free to turn your video off if you'd rather not be in the recording. We're also using automatic captions, which you can turn off using the Zoom menu bar down the bottom, or you can even turn them on. So please do keep yourself muted during the call. And if you've got a question or a comment as we go, please just use the chat box. We collect any questions for our guest speakers that appear in there when we get to that part of the meeting.
Where are the automatic captions?
Down the bottom, it should say live transcript next to participants in chat and so on at the bottom of the screen.
Oh, yeah. Wow.
There you go.
Okay.
Yeah, it does a pretty good job, but hilarity will ensue if you rely upon it. So if it's offered with no warranty. Right. So if you are new this evening, please do feel free to introduce yourself either by turning on your microphone and saying hello, or you can use the chat box. Of course, it's great to hear from new people and to hear where you're coming from, but it's quite okay if you'd prefer not to and just to stay quiet. Give a second for any new folks to say hi.
Heidi's waved her arms.
I'm Heidi. I'm from Letchworth.
Great. Welcome.
Hi, I'm Anna. I'm from Falkirk.
Hi, Anna. Welcome.
Hello, Anna.
Hi.
Hello.
Hi, I'm Sergio. I'm from Spain, but I live in London. Nice to meet you all.
Lovely to meet you, Sergio. Thanks for joining us in December. We're up to Christmas. It's the silly season. Everybody's very busy. So thanks to all of you for joining. Last call for anybody else new tonight.
Hi, I'm Sophie and I'm from London as well.
Hi, Sophie. Thanks for joining us. And I don't have the chat open. Let me do that. Oh no, okay, that's nobody in the chat. That's just Cameron telling us he's eating his dinner. Okay, right. Shall we jump into the rest of the call? But thank you to everybody for saying hi. We are going to start, as we usually do, with an update on what's been going on in the world of international development and how it affects the work of Results to bring about an end to global poverty. Unfortunately, we're starting off with not great news. So last month, I mentioned that following the spending review, we feared a further round of bad news on top of the £4.5 billion of cuts already announced. And sadly, it looks like this is happening. It looks like potentially up to an additional £1 billion of what will effectively amount to cuts in the 2022-2023 ODA budget. Unfortunately, we don't have time for me to go through that whole figure in detail tonight, but we've had one piece of news specifically on a part of it that I do need to share. I'm afraid that our initial celebration of a victory and our call for the COVID-19 vaccine donations that the UK is making to be over and above the ODA budget was premature. The government has confirmed that the cost of dose donations previously, they said it was on top of the £10 billion ODA budget announced on the 27th of October. But they've now told us that it will still count towards the 0.5% target. And so therefore it will displace other important spending priorities rather than being additional. This is not what Prime Minister Johnson had earlier confirmed from the dispatch box, and it's a particularly insidious U-turn. Now, this all might sound a bit confusing, but it's because the UK economy is growing. So 0.5% of gross national income is expected to take the ODA budget up to 11.4 billion in the financial year that starts next year. And it's this uplift that's going to be used to pay for the vaccines to be donated at that time. But of course, they could be spending that money on other priorities if they kept their original promise to be above the 0.5%. To make it worse, they're not telling us how much the donations will be priced at for the purposes of counting it in the aid budget. That's another fictional number that can, according to the aid rules, actually be different than the price we paid for them. This could mean that vaccines that were originally bought for the UK population but can no longer be used by us will be donated at an artificially inflated price, allocating these artificial costs in the order of around £300 million to the aid budget without anyone in the real world benefiting from it whatsoever. One of the speakers we'll introduce you to shortly will be talking about our next steps on this issue. We certainly aren't finished here with campaigning to get a much fairer global response to the COVID pandemic. You can find some analysis to this link in this link to the Bond website. We're going to pop that in the chat box. This was published just last week. A better piece of news that was in the budget was the announcement that the official development assistance would return to 0.7% of gross national income in the financial year 24-25. But I can assure you that given the reversals of recent months, we're certainly not taking that statement at face value, as it is far from guaranteed. The Chancellor said that that's when he expected the economic conditions for returning to 0.7% to be met. But that's not what we're hearing from some prominent development economists, even if current predictions about economic growth are accurate. Perhaps more importantly, that's still over 2 years away. That's 2 years of multi-billion pound cuts, significantly reducing programs where we could be doing so much more to save millions of extra lives, help build health systems at this critical time, and get more kids access to the quality, nutrition, and education they so dearly need. So we're expecting to need to keep an eye on the Oecd budget, in addition to the specific priorities that we have on health, nutrition, and education, which we're going to be hearing more about later on this call. We may need to ask you to take action on the Oecd budget again next year. Thank you for so much that everything that you've done this year to raise the issue with your MP. I can't lie, this may all feel like a terrible defeat, and it's not helpful for me to tell you that it's anything else, but I can assure you that your actions were a vital piece of groundwork for ongoing campaigning to defend and enhance the UK's contribution to fighting poverty around the world, and we're going to continue to do that. So now, and I know many of you are on tenterhooks about this, we need to talk about the Nutrition for Growth, or N4G Summit, which is happening today and tomorrow. I need to say up front that the news is mixed. In fact, given what we know right now, overall, it's pretty disappointing, though there are some highlights. First, I want to start by acknowledging and applauding the excellent leadership of the host country, Japan. They've been pushing very hard indeed for international donors to register their commitments right up to the opening of the summit, to the very last minute. Today, the Japanese Prime Minister announced a pledge from his country equivalent to $2.8 billion for 3 years, which is a really solid pledge. Indeed, in total, we've already seen more than 300 commitments from 148 stakeholders, including 66 countries and 19 private sector actors. They've all submitted their pledges, and the financial contribution of over $27 billion has been announced. And this sets the level of ambition we really need to see from the UK. However, I'm afraid that this is not to be, or at least not at this summit. And that's because the UK simply doesn't feature among the commitments and funding that I just mentioned. The UK will not be making any financial commitments at this N4G summit, nor will it be committing to continuing to reach 50 million people with nutrition interventions, as we've been strongly calling for this year. And indeed, even in the last few days, with many of you campaigning right up to the wire. We're going to be hearing more about your efforts on that in just a few minutes. So sadly, following the cuts to aid of around 70% to nutrition programming this year, the UK government has now made it abundantly clear that it has stepped right back from leadership on global nutrition. That's something it had previously shown for so many years, all the way back to David Cameron's government in 2013, when the UK kickstarted the whole N4G agenda here in London. To call this a massive missed opportunity is an understatement. And I know it will be so disappointing to many of you who've been active in the fight against malnutrition for several years now. If this is what global Britain means, then I'm afraid I'm far from impressed. Well, I'm sorry to say I'm not altogether surprised. But we were hopeful that the evident political support for nutrition from all of your efforts, for those of a coalition of organisations in the UK, as well as supportive MPs from all political parties, would lead to some kind of commitment. As it is, any renewed targets or funding commitments are expected absolutely no earlier than next March, when the FCDO strategy and spending processes are finalised. It's just a terrible excuse to delay providing vital and life-saving nutrition interventions to people that need them. But the summit wasn't a total loss. And I want to wrap up my opening remarks tonight by thanking you for achieving something truly extraordinary. What the UK Minister, Wendy Morton, did announce in her message to the summit today was something that we previously shared last Thursday on social media when it was first announced to Parliament. And that is, the government has agreed to use the OECD nutrition policy marker in the development of its programs around the world. Now, the OECD nutrition policy marker, particularly for the new people, this is an internationally accepted measure of the ability of a development program to have an impact on nutrition, and is something we asked you all to take action on earlier this year. This is a very technical thing. I'm pretty confident in saying that you lot are a part of a very select club of people who understand the nutrition policy marker, who know what it is, and you're part of an even smaller group of people who campaigned for it to be taken up. And you got that one over the line. You should be really proud, because it really is a very important win. It's one that will help ensure that the UK's development programs around the world do the most they can to tackle nutrition by design, whether it's a program about clean water or sanitation or access to healthcare or an education program. The FCDO is going to need to think about what those programs can do to help the community get adequate nutrition right from the start. This is very good news, especially at a time when far less money is being spent on nutrition than we would like. It's going to help other programs have a much greater impact on nutrition outcomes and should measurably increase the quality of UK aid spending. A massive thank you for everything you've done to achieve this result and to keep nutrition on the political agenda, even though we didn't get the financial commitment we wanted. Rest assured, we will come back to this in 2022. We unfortunately haven't got a speaker on the topic of nutrition tonight, as this is all breaking news, and we need to spend some time analysing what our next steps in advocacy should be, but we will be coming back to it. That's enough from me. I think it's time to hear about your actions around the UK over the last month, and I'm going to finish my remarks and hand over to Ruthie for the usual update.
Thanks, Aaron. So yeah, just to reiterate, a big thank you to everyone who's taken actions this year. And yeah, it's fair to say it hasn't been an easy time for our nutrition campaigning, but as you've just heard, there is some good news there. And yeah, although the rest is disappointing, we should think about the fact that we've spoken out on this issue and engaged with the government and the public to make sure that it's not, overlooked. So around 50 letters were sent to Liz Truss in the last month, calling for the UK to renew financial commitments to tackling malnutrition, which brings the total number of actions to around 80 this year. And this is only the ones that I know about, so I'm sure there's many more. A standard government reply we kept seeing stated that malnutrition is important for the UK government, and that, I quote, "We are continuing to work closely with the government of Japan to ensure the 2021 Nutrition for Growth Summit achieves meaningful new commitments to address malnutrition." And this letter that we saw a few times cited the economic impact of the COVID-19 pandemic and implying that that was a reason for less nutrition funding. However, I personally don't find this a particularly compelling reason, now that we know what the UK's government, what the UK commitment to the summit was. And I think those of us who receive such a reply can hold the government to account for the massive gap between what is said in letters and what is pledged at summits. So maybe there's some more letter writing there, but there's, as you'll hear later, other issues that we'll be focusing on next year. And you've not only been sending letters on nutrition, there's been lots of other actions as well. So I know recently Stephen in London met his MP and asked her to table a question on nutrition in Parliament. And last week we emailed a few of you whose MPs have shown specific interest in nutrition and asked you to invite them along to the Westminster Hall debate on nutrition for growth, which happened last Thursday. So thank you to those of you who acted so quickly and got in touch with your MP urging them to attend. If you're interested, you can rewatch the debate here, and that's where the OECD policy marker was first announced, although perhaps it is a little bittersweet knowing that there were no further announcements prior to the summit. And last month, as a final push in the nutrition campaigning, we asked groups to consider running an event to get more letters to Liz Truss. So we know this was an ambitious ask and not possible for all groups, but a big well done is deserved by Poole and Cheshire, who pulled something together really quickly. So I think we've got someone from Poole on the call who's happy to give us a bit of an update on what they did. I also have some photos if you'd like me to put up the photos you sent over.
Muted still. No. Oh. Is she doing the photographs? Oh. Oh, there they are. Yeah. Oh, that's good. Hello, Ruthie. Are you waiting for me to speak?
Yes, go ahead.
Oh, sorry. Yeah.
No, I was just getting the photos up. Can you see them now?
Yeah, the photos are all there. There's the blue board was one that Harriet produced, which is brilliant. We also did some on the orangey bit of paper. We did some sentences that people could use. We managed to fit in with another event. We started over a week ago. We were supposed to be doing a Sunday afternoon one, and very unfortunately, the chap who was running it had a bad road accident the night before, and it was cancelled. So we quickly thought, well, what can we do now? And I knew I was going to be doing a fair trade stall in our church cafe during the whole of last week. So we tagged it onto the fair trade stall, which was quite a good mix actually, because of course the people who were interested in fair trade were also quite easy to persuade to write a postcard. At least I think they were easy, were they, Deirdre?
Yes, not bad, although the way that the church hall is laid out, a lot of people had to come past us on the one-way system.
Yes.
So when I was there with Helen on Thursday afternoon, I kind of nobbled them and said, would you like to take a look at our action? And people were actually quite interested, and I think pleased. Most of them wanted to either write a postcard there and then, or they took it away and had a cup of coffee and then brought it back. And one or two of them took it away to somewhere else in Poole and then came back. And we also know that a number of them later in the week took the action through the QR code.
Yes, yes, because Harriet had enlarged the QR code for people.
And also another of our members, Janet, who's here tonight, is a member of a patchwork group, and she prepared a letter in advance, took it to the patchwork group, and all of the people there signed it, and she sent it off. So altogether, we reckon we probably reached maybe 30, 40 people. Something
it's
like
difficult to know, isn't it?
Hard to know, but at least 20 postcards and some emails and Janet's letter.
So we're very, very disappointed in the result of the M4G summit as a result.
Yeah, yes.
Anyway, there we go.
There we are.
Yeah.
Well, thank you for that update and for all your efforts. And to think that's 30, 40 more people who may not have even known the issue of malnutrition across the world and that the summit was happening. So I think you should be really proud of yourselves, regardless of the summit outcome. So yeah, well done to you all, and thank you for the photos as well. We always like seeing you doing your events. Yeah, thank you, well done to Cheshire as well. I think I won't hand over to you, but maybe if we have time later we can hear about Cheshire. But I know you also got lots of postcards sent and engaged a lot of people, again, who may have never even heard of the issues that malnutrition cause. So yeah, and there's other good news as well. Our August action called on the UK government to keep promises on global health, and we specifically referenced the pledge of 1.65 billion for the 2021 to 2025 period to Gavi, the Vaccine Alliance, and we recently had confirmation that the full pledge is safe, which is a big relief, especially given that many of you campaigned for an ambitious pledge back in the run-up to the Gavi replenishment in 2022. So this means that that funding won't be cut and will remain as promised initially. And over the year, so again, I don't have an exact figure, and it's not just the figures, it's the impact of each action. but around 300 actions and counting have been taken across the results network on a range of campaigns, from nutrition to COVID equity to global education and more. So we wanted to celebrate everything you've done and pick up on some of the highlights and say a big thank you, really. So I'm excited to share with you our results Grassroots scrapbook of 2021. And I'm going to quickly share my screen, but the link's in the chat so that you can have a look in your own time and looked in a bit more detail. So hopefully you can see that it's on our website.
Yep.
And if you click to read more, you'll see we've got sort of summaries of all the campaigns and lots of different actions that have happened this year. And if you spot something that's not in there that you feel should be in there, please do send me an email. So yeah, have a look at this and celebrate everything that's happened, going back to the aid campaign, official development assistance cuts back in January, where over 40 MPs were contacted, to the Gavi news. In fact, we've met MPs, civil servants, and ministers throughout the year, and your events, media and social media, Nutrition for Growth, our national conference, COVID, and a final message as a thank you to everything you've done. So I hope you enjoy looking through that. And as I said, send over anything that you think is missing, or if you have a photo lying there of a call you've had, then we'd love to add it in. We also took the opportunity on International Volunteer Day, which was on Sunday, the 5th of December, to celebrate volunteers working to end global poverty and team up with some of our partner organisations across the world to hear from campaigners. So you can also check out the new blog and see the brilliant message from Kendi, member of the Birmingham group, and messages from volunteers in Results Australia, Results US, and Results Canada. So that's also in the chat. And last but not least, I just want to mention that we'll be sending out a survey soon and asking you to take a few minutes to provide some feedback. So at the moment, we're reviewing how we support you as a network and considering what we could improve and do a bit differently. So this survey will feed into that review and really help us. So please keep an eye out for that. And when you do see it, we'd really appreciate it if you could take the time to fill it out. So I think that's everything from me. I'll hand back to you, Aaron. Thank you.
Thanks, Ruthie. Now let's jump straight into the topic of tonight's call, which is to update you on not one, but 3 priority campaigning issues that we're going to be working on in 2022. And those are, number 1, tuberculosis, or TB, which up until the COVID pandemic was the world's deadliest infectious disease, and which Results has a lot of expertise on, but something we haven't had much opportunity to campaign on publicly in the last year or so. Number 2, the ongoing campaign to ensure a fairer global response to the pandemic. That's the COVID pandemic this time, which will follow up on the advocacy we've been doing in 2021. And 3, on global education, which I'm very pleased to say that we're able to scale up our work on significantly this year. So, as we usually do at this time every year, we're asking Results in-house experts to share their thinking on why these issues matter, why we need to undertake advocacy on these issues, and what the opportunities are in 2022 for us to make a difference, and how we can collectively bring some pressure to bear. So I'm going to introduce our guest speakers now. I'm pretty sure I saw all of them on the call earlier, so I'm going to just kick this. Where's Vinny gone? I'm assuming you're here, Vinny.
I am here. Here.
Wonderful, very good. You weren't on the first page. There's too many people on the call. So let's go. So big welcome to Vinny Wooding. He is Results Parliamentary Advocacy Officer for Tuberculosis. Harry Bignor, the Policy Advocacy Officer for COVID-19, and Zila Nkeda, who's the Parliamentary Advocacy Officer, I should say, for Education. Welcome to you all. And thank you to all 3 of you for joining our Grassroots volunteer campaigners from right around the UK. after working hours. As you know, we've got people on the call who've been working on these issues for many years, and some you will have seen right from the beginning for whom this is their very first call. So this is really a great chance for us to go back to the big picture and explore why Results is working on these 3 issues, and what is it that's specific about now, about this moment in time, that makes them priorities to making positive change in the world in 2022. Now, as always, we've pre-prepared some questions for each of you, but before we get to those, I'm going to do the traditional thing, and this won't be weird at all, of asking you how you got into your area of work, a little bit about what you did before coming to Results, and what is it about your issue that fires you up and makes you want to come into work every morning. Bearing in mind that there's 3 people answering this one, so hoping to keep it a little bit short and punchy. Let's go in the same order I introduced everybody before. Vinny, we're going to go to you first.
Okay, to start, first of all, I apologise for the very unflattering light. It's not doing me any favours, but it's a real pleasure to be with you all this evening. Yeah, I think actually no, Zealand is newer than I am, so still relatively junior, but I thoroughly enjoyed it. So my role, as Aaron has previously mentioned, is my internet unstable?
It is a little patchy, Vinny. Maybe
can you still hear me?
It might. Now that we know what you look like, it might actually improve things if you turned off your camera.
Yeah, and now I don't have any light issues as well, which are making me unflattering. So yeah, so sorry, without me going off a tangent. So I'm relatively new to the role, but I was first sort of introduced to international development when I was working in Parliament. So I've never had a particular interest in it before that, but I ended up after university working for my local MP in Parliament. And after a series of events, he became the chair of the International Development Select Committee. So he did the role that Sarah Champion now does. You may have had some involvement with that, or you may have written to her, as a matter of fact, to actually think. So I used to work for the older Sarah Champion, and I was and just kind of being really immersed in it from really quickly. I was just fascinated that there was this whole kind of world of policy which I'd never even considered, which had never been really apparent to me. It's just a young lad doing politics and growing up in Liverpool. So that was when I first got interested in it. I guess the final point about what gets me up in the morning is sort of linked to it. So in my previous role, I was basically a civil servant, and I was working on housing policy. I was working for the government's housing arm, and it sort of dawned on me one day that I was kind of working with a lot of people who were really not passionate about what they did, and we were really struggling to enact change. And ultimately, I was finding myself working for an agenda that I wasn't passionate about. I just really could not get interested in it at all. But since coming to Results, I had my year-end appraisal today, and I was absolutely effusive with praise for the staff that we have at Results. It's so wonderful to work with people who are really passionate about what they do and really care about what they do. And we're really thoughtful about the way that we approach our work and the way that we approach our respective policy areas. And that has just been a real breath of fresh air for me. So I've got a real habit of talking too long. So I guess I'll pass over to someone else. Or am I taking the TV bit now and then passing to someone else?
No, we're good, Vinny. We're going to go straight over to Harry. So go on, Harry. Tell us a little bit about yourself. Why do you love your work? What gets you out of bed in the morning?
Thanks, Aaron. So I think I've met some of you before on previous calls, but for those I haven't met, I'm Harry Bignor. I'm the Policy Advocacy Officer on COVID-19, as Aaron said. And I've been with Results now since the end of April, so a little bit longer than Vinny. And I joined from Brook, who are an international livestock and equid welfare organisation. And I worked there on the global trade in donkey skins and on their Action for Animal Health campaign. So in terms of the landscape of both sectors and the organisations we work in, they're very different. But in terms of the kind of principles that we upheld in the animal health sector and the human health sector, there are really distinct similarities in the work, not least the principle of One Health. So this idea that human health, animal health, and environmental health are all inextricably interlinked. And obviously COVID-19 has given us real, tangible and horrible proof of that fact. Since joining Results, I've worked on dose donation asks ahead of the G7 with many of you who were involved with that work. And we pushed for redistribution and delivery of hoarded doses in a timely, transparent and affordable fashion. And I've also worked on the sort of holistic, longer term elements of the COVID response. So looking at intellectual property and the TRIPS waiver and other things to kind of upscale the global manufacture of vaccines. And why the work's important to me, I think I'm motivated by the same reasons that I'm sure many of you are, which is just that it's so patently unjust that whilst many of us are being offered our third dose of the COVID vaccine, there are people around the world working on the front line of the COVID response or living with autoimmune diseases, which weakens their resistance to the virus, who have yet to even receive their first dose, and all because they weren't born into a rich country, as I was fortunate enough to be. I feel like COVID is one of the biggest tests of global solidarity and a test of the strength of international health systems. And it's become really abundantly clear over the last 18 months that we've a really, really long way to go. But there's definitely space for improvement. And despite a lot of the dispiriting news that we've received across this year, there's definitely capacity and political will to do better and to change. We just need to keep up that pressure. So that's why what I do is important to me. And I suppose that's what gets me out of bed in the morning.
Thanks, thanks, Harry. That's great. Let's go over to Zealand.
Hi everyone, it's so wonderful to finally meet you all. I've heard so many wonderful things about the Grassroots network and how passionate you all are. As Aaron says, my name is Zealand. I started working with Results in September as the Parliamentary Advocacy Officer for Education. I'm passionate about working in the education sector and ensuring that all children are given the opportunity to learn and explore so that they can fulfill their potential. And I firmly believe that good quality education is a right, it's not a luxury. And I fundamentally believe that we all have that power to generate the realization of such rights with our collective voice. And not a million years ago, my family moved to the UK as political asylum, and I was one of those children whom wonderful people like yourselves campaigned for and believed that they had potential to meet and achieve. And since then, I've been given immeasurable opportunities that I couldn't have even dreamed of as a 6-year-old. And prior to joining Results, like Vinny, I was working in Parliament. And then I've also had spells as campaigns and research advisor for a women's organisation. And for a long period of time, I worked as a senior government advisor in the Middle East.
That's great. Thank you very much for sharing that. I always learn things about all our guest speakers when they do this bit of the call. It's one of my favorite parts. So thank you, all three of you, for sharing all of that. Let's go straight into our pre-arranged questions before we open the floor to everybody. When we do that, you can text in a question tonight. The number is going to go in the chat, 0777 56 11178. That's 0777 56 11178. While you get your questions ready, and as you think of them, we're going to go straight to the first pre-prepared one, which I believe is coming from Jay in Cheshire. I saw him earlier. Jay, I think you're still on mute. There you go.
Sorry. Okay. Sorry. Good evening, Winnie. I was just saying that I'm part of Macclesfield Group, and we have campaigned for an end to TB for decades. I particularly remember when I joined Results in late 80s, the first 3 years, we were campaigning really hard on TB. Since then, we have Results has done so much work on TB. And I remember 1 year presenting a report produced by Results to our MP in front of our town hall. So, so my question is, why is next year particularly important for the campaign?
Thank you very much, Jay. Thank you very much. And it's really great to hear that you've been a long-standing campaigner on TB issues, because I think one of the good ways to start is to say that in a lot of ways, I think TB is probably the worst disease you've never heard of. Because one of the things that's really surprised me since starting this role is how few people know what TB is, or what it affects, or which parts of the world it's particularly prevalent in. So before I kind of jump into the question, I'd just like to kind of go back over some of the details of what TB is. So as Aaron said earlier, actually TB before COVID, TB was the world's deadliest infectious disease. As recently as 2017, 1.5 million people a year were dying of TB, and 10 million people a year were contracting it. And if that, 1.5, I mean, I was absolutely shocked when I first heard that, and I think it's one of the reasons why I'm so passionate now going forward that we really need to get this solved. So actually, in a lot of ways, the COVID it passes from person to person through close contact, through droplets in the air, in a similar way to COVID. So we sort of got a bit of a better sense now as to how these kind of diseases and things spread. TB has been ravaging parts of the world for decades. We've got part of the problem. So I guess the biggest problem for TB is that we've seen how quickly we've managed to wheel out a load of COVID vaccines. In the last 100 years, there's been one TB vaccine. That TB vaccine is 100 years old. It actually celebrated its 100-year anniversary this year, which again is shocking. This is a disease which is killing millions of people a year, and there's one vaccine, and it's actually not particularly effective in the grand scheme of things. So we've got a lot of work to do in this space. We've got a lot of work to do, and I think the final point I'll just say on TB itself is that TB is very susceptible to antimicrobial resistance, and one of the sort of the issues that continues to pop up in the TB sector is that we get these strains of tuberculosis which are resistant to the drugs that we have. So imagine being in a situation where you contract TB and you go through this horrible process, this horrible illness, and to find out that actually that what little drugs we do have are completely ineffective for you. So you have to go on an even more aggressive treatment, an even more aggressive regimen. I think, and I think the picture I'm trying to paint here is how, in a lot of ways, how bleak the situation is for TB, because it's been neglected for so long. The tools, the diagnosis, the medicines are just not sufficient to deal with the problem, and this problem's been around for ages. So why is next year particularly important? And there's a couple of reasons. Really. Some of the quote unquote less important ones, although I would argue that they're all important, but you'll see as I explain. So one of the big ones is that Indonesia is going to be holds the presidency of the G20 next year. And Indonesia has the third highest TB burden globally. So this is a really good opportunity for us to get TB high up the agenda at the G20, to get those conversations between health ministers, foreign ministers, prime ministers. And that's something that obviously we're going to be pushing really hard on. 2023, there's what's called a UN high-level meeting on TB. There was one in 2018, which outlines a load of targets and goals which the international community signed up for. We're really struggling to meet them, and we've got 1 year to do it. So next year is going to be a really big year for making sure we get that right. But I think probably the biggest problem, and this is what the most important thing for next year, and this is the point that I'll wrap up on, is we're going into a period of replenishment for an organisation called the Global Fund. Now, some of you may have heard of the Global Fund before, but its full title is the Global Fund to Fight AIDS, TB, and Malaria. And it's the world's largest financier of HIV/AIDS, TB, and malaria in terms of prevention, treatment, and care programs. So this is, and I can't stress this enough, one of the most important and vital organisations for TB response in the world. and they are approaching a really big replenishment period next October. And we have I guess within the context of the development environment that Aaron outlined earlier, we have to guarantee that the UK makes as strong and comprehensive a pledge as possible, because TB has continued to ravage in the background while COVID has been going on. It hasn't gone away. It's actually gotten a lot worse. And we really need the international community to step up with a really comprehensive financial package that's going to allow us over the next 3 years to really tackle this problem. So I'll stop there because I'm conscious that we have some other speakers, but I look forward to some of your questions later.
Thanks, Vinny. Without further ado, let's jump over to the second question, which is going to come from Emily in Bristol.
Hi. So my question's on COVID. So it's to Harry. Have we made any progress towards a fairer global response to the pandemic, and what needs to happen next?
Thanks, Emily. I think it's really tempting to think that with all the things that I said in my opening and the enormous disparity that we're continuing to see in global access to COVID tools and the huge disparity in vaccination rates, that we haven't made any progress, but that's really not true. We as a group have held the government's feet to the fire on a number of issues related to inequity and access to COVID tools. And while the response we've seen today is insufficient in terms of the size and the sort of seismic shifts that are needed to address the scale of the problem that we're seeing at the moment, we have seen a response. So we've seen the government commit to sharing vaccines that it hoarded. We've seen them engaging in discussions on a waiver on intellectual property, even if to date they have continued to block the TRIPS waiver. Just last week, in a response to a question from MP Gareth Thomas, Secretary of State for International Trade, Anne-Marie Trevelyan, said that the government is continuing to have conversations on the TRIPS waiver at the World Trade Organization, and that's a more open response than we've had from the government to date on this issue. Conservative MP Dan Poulter also published an op-ed in support of the TRIPS waiver, which is a really important show of solidarity from within the party. Even if we're not seeing the response from the UK government we would want yet, we've seen a number of other countries come out in support of the waiver. And we've also been able to show solidarity to those countries who are continuing to be precluded access, amplifying their messages and their calls to action. We've also seen a response from pharmaceutical companies, with AstraZeneca striking a number of voluntary licenses with manufacturers to upscale production of the vaccine, and Merck, who are the company responsible for developing an affordable, scalable, easy to administer treatment for COVID, agreeing to share its license with a not-for-profit organization to upscale global manufacture and expand access to the treatment over 100 countries. These are all signs that we are making progress on a fairer global response to the pandemic, but the new Omicron variant has demonstrated how quickly the government will revert to buying and hoarding doses for its own population, making the same mistakes in terms of impeding global access to vaccines and other COVID tools that it has throughout the last 18 months. So therefore, in terms of what needs to happen next, we as a group need to continue pressure on the UK government to support the TRIPS waiver proposed by the governments of South Africa and India, highlighting that it doesn't need to be a case of boosters for us or vaccines for low and middle income countries. If they would allow manufacturing companies around the world to start producing and helping countries to be responsible for their own supply of COVID tools, as opposed to waiting for COVAX deliveries, we could have both. We could have boosters and we could have vaccines for countries around the world. There are some key financing moments throughout the next year as well for organisations that focus in part on the COVID response. One of which Vinny talked about in his update, which is the Global Fund. There are others, one called the Coalition for Epidemic Preparedness Initiatives, which is sort of colloquially known as CEPI. So we'll be working to ensure that the UK government commits its fair share to these organisations, working to address the current pandemic and future-proof against future pandemics. And we need to continue to press the government to deliver its promised doses with at least 10 weeks before they expire to ensure that countries can administer them. And as well as all of this, we need to continue to amplify the voices of affected communities, civil society organisations and healthcare professionals that work in countries that are worse impacted by the inequity that we're seeing in access to COVID tools to date.
Thanks so much, Harry. Really comprehensive to the table of what's going on in a very complicated and busy part of the global health landscape. We're going to jump straight across to our third question, which tonight is coming from Anna in Edinburgh.
Hi, yeah, so this question is for Zealand on education. Given schooling around the world has been disrupted by the COVID-19 pandemic, what do we need to see happen so that all children have access to good quality education?
Thank you, Anna. So this is a multi-layered question. And in order to answer that sufficiently, we need to take a step back and start from a position where the pre-existing inequalities are evident to us. Marginalized groups such as girls, disabled children, stateless and refugee children were already enormously affected by policies and practices that were detrimental to the realization of their educational capability. But the pandemic has only compounded those existing issues, but it's also given us the space to look at what wasn't working so we can deconstruct those issues and then rebuild a system that does work for all. Globally, we are in a learning crisis. Although education is a basic right stipulated in the Universal Declaration of Rights and an infinite number of acts, pledges, and initiatives, many countries are facing challenges in addressing its realization. Over the last 3 decades or so, there's been critical events that have sparked public and political dialogue, which has led to action on education. But these actions and pledges have generated global interest in education as a form of human developmental policy, and that's ensured that there's access to education. But it's also entirely negated to ensure that children are actually learning whilst they are attending school. Although access to education is a good step, learning outcomes are critical and they must be tracked against agreed upon learning metrics. That means that there has to be a global shift from merely access to education to learning. In this context, the importance of foundational literacy and numeracy emerges. FLN, it refers to the concept of building basic literacy and numeracy skills during the early years of primary school. And although the importance of literacy and numeracy isn't a new concept to any of us, the global focus on FLN is relatively new development. Learning levels are low in developing countries, particularly in disadvantaged communities. Studies show that 1/4 to half of children who have completed primary school can't read a single sentence. But even more significantly, education must keep up with changing demands for skill in the labour market. In low and middle income countries, only half of primary school age children and less than 1/4 of secondary school age children are learning basic skills based on international learning assessments. And if we continue on that trajectory, it means that by 2030, 9 out of 10 children aged 10 in low-income countries will not have those skills. So it becomes clear FLN is the bedrock of education systems, and without addressing that, Sustainable Development Goals on universal education, which are intended to address many social ills, cannot be met. So now we've deconstructed that, we need to reconstruct it. In the long term, in order for all children to be able to access good quality education, there has to be system-wide reforms. There has to be better and deeper understanding of the learning crisis. We need quality teaching and measurable levels of learning. To do this, we need policy support, more funding, and the recruitment, training, and retention of teachers. But in the short term, where possible and safe to do so, children and their families need to be given the option to return to school. And where this is not a possibility, we need tech and low-tech solutions to be made possible so children can continue to learn and meet their developmental goals.
Dylan, fabulous. Thanks for keeping it short. This is going to give us a good opportunity to ask some questions back. Which is what we're going to do right now. It's time to give everyone on this call the chance to ask some more in-depth questions about all 3 of these issues. We'll try and get through as much as we can the last 10 minutes we have. And we want to try and make sure we get at least one question for each of our speakers, and we can parallel it up a bit by maybe answering some in the chat as we go if lots come in. So do we have somebody that wants to ask a verbal question? Be first and ask either Vinny, Harry, or Zealand a question. Jill, I see your hand is up.
It's a question that all 3 talks were really good, but I couldn't get them down. Is there somewhere where you can share the transcript of those, please? That would be really helpful.
Ruthie's put an answer in the chat. I mean, we have the automatic transcript, but as I said, that's more of a help than a proper transcript. And I don't think we have the staff time in the run up to Christmas to type everything up. No. But you can, of course, listen back. But we'll see what we can do, Jill.
I thought maybe some of you might have it already written down in a Word document.
Yeah,
No,
I can share.
Elegant. It was straight off the bat.
All right. Oh, well done.
No, it's a lie. I can share my notes.
No, thank you.
Yeah, I can share mine as well.
Thanks.
I winged mine.
I don't want to give you extra work, but if you had it written down already, you know. Thanks.
Can I just add in that action materials for this month also include a very brief summary of each of those 3 issues. So
right, yes.
You could check in on that. It won't be exactly what you heard, but it'll contain similar stuff.
Emily, thanks for sharing that article. Does that turn into a question for Vinny or for Harry, perhaps?
Well, can do. I mean, it was really, the article's about, the gist of the article is that for a lot of the developing worlds, COVID isn't that much of an issue because of the younger demographic, but the impact of COVID is things like lack of malaria, lack of polio, lack of TB input. So it's the effect and the effect on the economy. So not particularly a question, but unless anyone wants to reply to it.
I mean, I could pick up on that, and I will switch my video off again just for technical problems. I think you've hit on something really interesting there, Emily. Because you are right in a lot of ways that these sort of other pandemics have been raging on quietly in the background. But I think the thing that has kind of exacerbated the problem the most is that, especially within the TB space, because of the similarities in the disease and sort of relative treatments, what we found was that when COVID became more prevalent, actually a lot of TB services immediately switched to COVID. So all the staff were kind of reappropriated to COVID, and the wards were taken over for other infectious diseases, which had the obviously knock-on effect of then neglecting people who had TB. And of course, you're telling people to stay in the homes, don't have contact with people. Now, when you've got TB, that really isn't sufficient, because you need to get medicines, you need to see a doctor. So I think you've really hit the nail on the head there, Emily. What we've had is, although COVID, the impact of COVID may not be as severe, arguably, and I haven't seen any data on it to suggest that this necessarily is the case, that COVID is less severe in some other parts of the world. It has had the direct effect of basically taking away resources from other diseases which are now suffering.
One data point that I learned just this earlier today was that the resource needs have gone up from £101 billion to fight the 3 diseases of AIDS, TB and malaria for the last 3-year period of the Global Fund strategy, up from 101 to up to at least 128.5 billion over the next 3-year period. So that's nearly a $30 billion increase, and nearly a $10 billion a year more increase in the cost to fight those 3 diseases. And the lion's share of that is actually in TB, because the programs have all been hit so hard. So yeah, it's very, very much that kind of impact that Vinny was talking about in terms of all of the TB programs being shuffled across to COVID. Very, very powerful knock-on effects there.
Yeah, sorry, just Aaron, there's a lot in that article about the effect on schooling as well, and particularly women, girls. So loads of no schooling, early pregnancy, early marriage, blah, the stuff we know all too well, sadly.
And I think what you're seeing there, Emily, is that, of course, just like the Sustainable Development Goals, all of the things that we work on at Results are related to each other. Zealand, I don't know if you want to respond back to that point from Emily about some of those knock-on effects and what that means.
Yeah, I mean, absolutely. As I said in my answer, it's compounded all of these things into one and exacerbated all of the fault lines we've already seen. But in the global south, we've seen particularly hard knock-on effects, especially for girls, especially for places where around the world we're seeing girls can't go back to school whatsoever, in places like Afghanistan. And that's why I think in the next year we have to move harder than ever to ensure that, you know, we are moving the needle on the thread.
Thanks for that. Just drawing people's attention to Harry's comment in the chat on the following up on other questions in the chat about vaccine manufacture and barriers and so on. Do we have any other questions in the last minute and a half? If not, I'm going to take chair's privilege and just have a couple of just really quick remarks. Oh, Ricky, you were typing. Okay, let's take that one. Do we think the short shelf life vaccines donated by the UK will go against ODA spending? There is actually, well, actually, Harry, you're the expert. Go on.
Well, I mean, we've actually, yeah, we've seen that a number of the doses that have been donated already have gone with such a short shelf life that even though they're not being administered, they still are being counted as ODA. So there's a very good indication that yes, they will still be counted as ODA spending, regardless of whether they actually make it into arms or not. And interestingly, there's a coalition that's been set up by a number of African countries called ABAT. I can't remember what ABAT stands for, but I'll share. Oh, it's in the article that I just shared in the chat. And they've basically published a list of requirements of the doses being shared, because what we're seeing today is a lot of the doses being shared have got far too short a shelf life, and there are a number of other issues with them as well. So there's a new list of requirements from ABAT, who are working with COVAX, to ask for sort of better quality doses that will enable countries to administer them properly.
And of course, ultimately, we don't want vaccine donations. You know, that's the, you know, we find ourselves having deliberately bought up all of the supply. And now, of course, we bought up more than we know what to do with, and other people are paying for our greed, and we're not even helping them out properly in terms of making that mobilise. So this is something we're absolutely going to be continuing to look at. And apologies to Karen, but in my defence, I could not have possibly known. I'm afraid we are at time tonight, so I'm very sorry that we're going to have to start wrapping everything up, but I will just say one thing. You know, we have had a very, very tough 2021, and it was on the heels of a very, very tough 2020. One of the things that gives me lots of courage and strength is this group of people on this call. You're a wonderful group of people, and just the fact that you turn up month after month to keep on pushing on these issues and take really, really smart actions is truly extraordinary. When I said earlier that there's only a very small group of people that even know what an OECD policy marker on nutrition is or what it could do, let alone do some grassroots campaigning on it, that really is extraordinary. When we talk to other people working in the sector and say we have a grassroots network that campaigns on things like that, they kind of don't really believe us, because why on earth would you be asking ordinary UK citizens and people living in the UK to be campaigning on something so technical? Well, we do that because you guys are just so good at what you do. We can trust you with all of that information. And you go out there and get results on it. And those things really, really do matter. They're the things that when times are tough in terms of funding, making sure that we can actually have the best spending possible really it is just so very important. Right. But we really do have to say goodbye because we've run out of time. I really wish we'd had more, but thank you for the questions that you did have. Thanks to our three speakers for covering what are vast campaign areas and really, really briefly. There's more on the action materials, and I hope this discussion this evening has helped you get an idea of the campaigning you can be a part of in the coming year. As we go through the year, we're planning to continue to invite speakers to help us go into all of these issues in more depth. So I hope you'll have a think in your groups and individually about what exactly it is that you're most passionate about and why. And I hope that you'll be able to take this month's action, which is to plan your year ahead. And don't forget to celebrate all your hard work in 2021 and the victories that we did win. As always, if you're going to meet in person, please do it safely, especially with Omicron around. If there's anything we can do to help, whether it's to help pay for a safe meeting venue or access to technology, do call the Grassroots team. We're really keen to help facilitate that. Last of all, one final thank you to all of your efforts this year. We certainly didn't get everything that we wanted from the government, but we're not going to go away. And I'm personally really looking forward to working with you next year to help keep making that moral and practical case for ending global poverty and inequality. One very final logistical announcement. As we do every year, the January conference call is going to be put back by a week because of the Christmas and New Year's break. So unlike every other month of the year, in January, it's going to be on Tuesday, the 11th of January. So it's the second Tuesday in January, not January the 4th. That's actually the first day back at work for most of us. And it's a pretty brutal first day back. We've all got to be up late. So it's going to be on Tuesday, the 11th, but it is at the same time, 8 p.m. as usual. So look, enough from me. Thank you for everything. Good night for now, and do enjoy the rest of your evenings.